what we will discuss in the next 3 days in the virtual study visit is applicable and generalized to many other vulnerable groups. In this respect, I'm really very happy to tell you that today with us are more than 10 providers from rehabilitation centers, another 10 providers from daycare centers. We have representatives, more than 5 from the employment agency. We have representatives from public daycare centers. We have the representatives of the Ministry of Labor and Social Policy with us. And we have the pleasure to have with us also our task manager, Nafisa Razzini from the EUD, that is really going to give us some introduction and welcoming for our event. So with that and with my warmest welcome, I would like to pass the floor to Nafi. Thank you.
Thank you, Maria. I hope you are listening. So I just want, on behalf of EU delegation, Skopje, to wish you successful work during the next 3 years. I'm sure that you will have plenty of opportunities to exchange your experience and to learn from experience of Lithuania, member state. And I'm sure that it will be very useful. Unfortunately, as Maria explained, we were not in position this year to be there on the field, because usually study visits are exactly planned to go and to see and to touch things, how they look in other circumstances in the member state countries. But unfortunately, we cannot do that in such way. But I hope this kind of compensation will be useful and will work out. So I want about this to thank especially Maria and her team about the enthusiasm and engagement to make this possible. Although in the beginning we were a bit skeptical about virtual study visit, that sounds a bit weird, but however, it is here, and let's see how it works, and hopefully it will be useful, and hopefully it will be replicated with other projects in cases where we cannot physically be able to go and to see how things are developed in other places. So for the EU integration process of the country, it is very important. This project is very important because it deals with social services, and it deals with one of key activities within the social services, deинstitutionalization. And therefore, it is important to start and to finish all reforms that has been introduced with the new law on social protection. And therefore, we have this wonderful and very enthusiastic team led by Maria to help all the institutions in the country and the ministry to implement these reforms. And therefore, this study visit is part of those efforts. And hopefully, we will have a successful, enjoyable time and really have opportunity to learn from each other many new and important things. So I just want to finish here and to wish you successful work in the next 3 days. And also, I not forget to thank the Lithuanian colleagues for being available and being kind to organize this study tour. As far as I know, for us, it's the first time that we do it in virtual. At least for us in delegation, it's the first time to do it in virtual way. Let's see how it works, and I wish it is going to be successful. So, thank you.
Thank you very much, Nafi. Indeed, COVID is making us to reinvent ourselves, to be innovative, to think out of the box, and to find ways that we can continue our work, we can continue our activities, in ways that would allow us to be as successful and as productive. This study visit, although it's online and virtual, it has all the features and all the structure of a typical study visit of the ones that we used to do in the previous projects. And I'm sure that Rasa, who has the experience of many other projects and many other study visits, a very good colleague from the Walakupiai Center will give us a lot of insights that will really help us to understand the context. So Rasa, it is a great pleasure. It is an honor to have you with us. Thank you very much. We are grateful for the sharing and for hosting us in your beautiful center. Please have the floor.
Thank you. Good morning, everybody. So for us, it's also an honor to be the host of the virtual visit for you. As 3 days virtual visit is also for us the first time. So we try to do our best to tell you, to show you what we have here in our organization in Walakupiai. I will start with a presentation of myself. So I am Rasa Noreikite Ustinavičienė. I am the head of the development unit at Walakupiai Rehabilitation Center. And me and my colleagues these 3 days are going to tell you about what we do in our organization, who we are, what we do, what kind of services do we provide, what kind of challenges do we meet. Also are going to share with you our challenges that we face in the institutionalization process that we also feel in Lithuania. So me, myself, I work in Walakupiai and also in disability sector for 16 years now. I started my professional career here and started as a social worker. Then I had an opportunity to change my positions in the same organization and be involved in different European projects, also in different innovation processes. We do a lot of developments since 2004 when I started to work in this organization. And I have prepared my slides and share them on my screen with you and start the story about our organization. I hope you see the slides. Some words about Lithuania. So as you probably know, we are just in a distance of 2,000 kilometers from you, from Macedonia. So it's a big distance in kilometers, but it's not a big distance in the challenges and that we face probably working with different people providing social services. So some words about Lithuania that you would get the overview of how big we are and how many people with disabilities we have in our country. So we have a capital, Vilnius, and Walakupiai Rehabilitation Center is also located in Vilnius, but also have another unit in the second biggest town of Lithuania, Kaunas. And we are almost 3 million people here in Lithuania living, and about 230,000 people have different kind of disabilities. So it makes about 8% of total population, and it's an average of European Union, I would say. And only 30% of all people with disabilities have a job, works in social enterprises or in the open labor market. So it's a really very little part of people of working age who are occupied and have a job. So the organization Walakupiai Rehabilitation Center was established in 2002. So it's almost 30 years ago. And we are established under the Ministry of Social Affairs, under the Department of the Affairs of People with Disabilities. So we are a public institution, but we are, our funder is the state. And when the organization was established, we had a unique mission to provide, improve, and develop different services for people with disabilities, including vocational rehabilitation, medical rehabilitation, and social services. And our main goal is to improve the quality of life of people with disabilities in Lithuania. So, as you probably understand, we act in different areas, such as education, employment, healthcare, and social care. And we have more than 100 staff in our organization, and they are different kind of professionals, but I will tell you about that a little bit later. So, in two departments, in Vilnius and Kaunas department, we have different services. So, in Kaunas department, we have a big block of social services and social integration services. And in Vilnius department, we have different kind of services, starting from medical rehabilitation. We have a driving school for people with movement disorders, those who have physical disabilities and face the problems to get the driving license in the ordinary driving schools. We also are the vocational rehabilitation and vocational training center for people with disabilities. It means that people can come and get the needed vocational training and needed help to get employed afterwards. We also act as a methodological center. It means that we are involved in different development of laws, of procedures, of trainings, and we also do a lot of training for another organizations in Lithuania, but also we do some trainings for professionals from other countries, as today for you. We have quite a flat organizational structure. Our director, Tatiana Ulbinienė, is responsible for all the services provided in the organization. And we have several units like medical rehabilitation, vocational rehabilitation, also development unit. I am from this unit myself, and all other units who help to ensure all the processes in the organizations, like human resources, like general maintenance of the building, finances, and so on. And as I said, we also have a Kaunas unit. It's the unit in the second biggest town of Lithuania. And our establisher is the Department of People, of the Affairs of People with Disabilities. And this department is under the Social Affairs Ministry. So this is how we look as the organization. And in one moment, we can say that we can provide services for 130 service users at one time. So in Vilnius location, we have also some like rooms, like where the patients and service users can stay and can be accommodated during the services. And also 50 outpatients, like the service users who come only for the daily activities. And also in Kaunas department, we have capacities to provide for 30 service users. So in one time, we work with more 100 people in normal conditions, not in a COVID situation, unfortunately. As the services are so different, starting from education and ending with a medical rehabilitation, so also our team is very have different qualities and qualifications. So we have a full medical team, starting with the medical rehabilitation doctors, nurses, physiotherapists, occupational therapists, but we also have a team who works with the education, with the training of people with disabilities. with the help to get employed or to solve some problems and so on. So also project managers and researchers are involved in the team. So, and also we as the organization acting in the disability field ourselves, we try to be a leader, and part of our team also are the people with disabilities, and the qualified staff and also simple workers in our organization. So a little bit about every service that I have mentioned, and my colleagues that you meet today or in a week or in the third day will tell you about each service in details, but now a common view. So starting about the vocational rehabilitation services. So this kind of service was started to regulate by the law almost 15 years ago, probably. It was a new service that set up the finances that person with disability who is willing to get a job, who would like to get employed, would come and get different kind of services that are important for the successful integration to the labor market. So the aim of the service is to improve the current situation of a person, including capacity to work, the professional competences, the qualification, but also what is related with the kind of restrictions he or she has related with the disability. So for those who have movement, physical problems, they could come and use physiotherapist, occupational therapist help. Those who have some kind of psychological problems could work with a psychologist and so on. So the services comprise of these subparts, like we start with the assessment of vocational skills, vocational guidance and counseling. If the person do not know what kind of profession or training he's willing to go for, or what kind of job he wants to work. Also the restoration and development of vocational skills. This part also includes the rehabilitation part and vocational training. So we have different programs starting from the administration, finance management, ICT skills, but also those related with the handcrafts, like sewing, like woodwork, and different kind of other vocational training. And very important part is also employment assistance and workplace support. So it means that when the person finishes the vocational training, he gets the support of the employment counselor, and he works with the companies and with the skills needed for going for the interview at the company and presenting yourself. And during the vocational rehabilitation process, a person with disability can get the accommodation if he's not from this city, if he's from another city, and also like a vocational rehabilitation allowance that helps him to get, because if the person stays not at home but comes to our center, he has probably some also expenses, and this vocational rehabilitation is to motivate person and to compensate some expenses that person faces during the services. So that's shortly about the vocational rehabilitation. If to understand in numbers, I just shortly tell you that, for example, on a yearly basis in medical rehabilitation, we have around 800-900 normally per year, but as last year, 2020, was very complicated we also had some months to be closed and not to provide some services. One was the peak of all the COVID cases. So last year was really complicated in most of the services. We had less clients, but less service users. And for vocational rehabilitation, it was not the case because the employment results were quite high. So in this slide, you see that it's last year it was 90% of all clients were employed. But of course, the number of vocational client users was also a little bit lower because of the COVID situation. About these social services in Kaunas unit, so as I mentioned, another unit is located in the second biggest town, Kaunas, and there we have a big scope of social services, also mainly for people with disabilities or elderly people who have some health problems. So we provide different services like a daycare in the organization, but also home assistance. We have several assistants of social workers that goes to individual homes of where elderly people are living and provides them different support they need, starting from the buying the needed products or preparing the food or helping with the heating of the house or whatever, anything what is needed for these elderly persons. And we also have a daycare center for people with intellectual and complex disabilities, and people coming there to spend their day, to be more involved in different activities, starting with learning the new things, but also doing some arts, some also simple tasks that are related with the being more independent, being more busy during the day. So probably that's shortly about the Kaunas unit. Another program that we have with the aim also for people with disabilities to be more independent, to be more ready for labor market. It's two programs. One is the driving school for people with movement disorders, and also the social rehabilitation for people who have visual impairments, mainly blind people or have very low level of the vision. And yearly, if we get the contract from the state, we provide this kind of services. But for example, in driving school, we specialized for almost 20 years. So since the beginning, we had this kind of program, and we have a qualified staff who explains how to drive a car, how to go from the wheelchair and sit to the car and put your wheelchair yourself in the car. And we also have the instructors who teach how learn the theoretical knowledge and also the practical driving skills in the streets. So, for example, last year, even with the COVID situation, in a very complicated time, we have provided these services for 14 persons. If even the plan was to provide it for 30 people, so we made less than half of our plan. But the COVID situation, the problems that we faced to secure good conditions for the staff and for the service users, we ended up with 14 service users. So the people gets their driving license, they are more independent, they can freely move from one place to another, and also it helps for getting a job, because for most of the people who are trying to find a job, a very big issue is how to get to the company, get to the working place. Another program that we also have is the social rehabilitation for people with visual impairments. We have provided this service for 21 persons last year, and the program includes different services that also helps to become more independent in daily life for people who are blind or have a very low level of vision. So our staff, the social workers, the psychologists, the Tiflo-pedagogues, ICT trainers works with the persons individually and in the groups, and they learn how to move independently in the new environment using the special white stick, or they also learn how to write and read with Braille, and they also work a lot of with ICT new tools. There are so many different programs and software and apps that help for people with visual problems to be more independent. So, and there are new things every year. So our ICT trainer works introducing and training these people to use the computer and mobile phone for all these kind of ICT support. So I think that's it about this program. We as the organization, we had also a big focus on the quality management, and so we have different tools to ensure the quality management in the organization. So one of these external, let's say, frameworks that we are using for shaping our processes and counting the results and different indicators of the activities. So we use ISO system for many years now, and it helps to control the processes, to aware for everyone in the same way, to understand the processes in the organization and to provide the services in the same level of the quality. And another quality framework that we use is the IQAS assurance level. This is the European Quality in Social Services mark, and for more than 10 years we are using this framework to provide our services. And I will talk a little bit more about the IQAS assurance quality system and how it helps for us to be oriented to a better quality of our services. So this is the external quality management things that we are using, but there are lots of internal ones like qualification of the staff, as meetings and teamwork, solving the different situations of the persons, of our service users, also all different kind of activities. So just a little bit more about the IQAS assurance model. This is the IQAS system was created more than 10 years ago by European platform. How is the name? It's the European Platform for Rehabilitation. So the experts of different areas have come and decided what are the core things to assure the quality in social services, including also the disability sector. And the system also is created according the common framework of the social common framework of quality of social services that are approved by European Commission. So there are 10 levels of the quality, the 10 principles, and as you see in this scheme, It talks about the leadership, what is the good leading of the organization. Also talks about the staff and professionals, about their qualification, about how to motivate them, how to sorry, I don't find the right word, but how to retain these people in the organization. Also, continuous improvement has a big focus, so it means not that we do and check if it's all right, but we also plan what kind of improvements should be done based on the results we achieved, and also result orientation. So we check what we did, what is the satisfaction of the service users, and we plan the continuous improvement actions. So probably it's very common for different kind of quality frameworks, but what is unique for ICVAS, for social service sector, so it talks about the social sector, what is important in it. So it's about rights of the service users, also about the ethics of the staff, and in social services, also very important parts like a partnership and participation of the service users, and that all services should be person-centered according to the person needs, and comprehensiveness is also emphasized on this model, that person do not get only one service needed, but the all approach that the situation that person is in is taken into account, and the services, if not in the organization, so outside of the organizations, are arranged, and the person gets the support. So this is the 10 principles of ICVAS. If you have more questions, you can ask me later on, or also talk with our colleagues, especially Natalia that you meet today in the afternoon. And I think it's a kind of framework that really helps to orientate in the social area. So talking about the ICVAS, I also would like to tell you the story that we are not only the ones who use this framework, but we also cooperate with the European Platform for Rehabilitation, and we are the National Center for ICVAS Assurance in Lithuania. And at the moment, we also implement a big project that we are going to finish next year. So together with the Social Security and Labor Ministry and with EPR, European Platform for Rehabilitation, we are helping for 120 organizations in Lithuania to improve their quality of social services and get the certification of ICVAS assurance system. So we work very closely with all these 120 organizations, supporting them, consulting how to fulfill the requirements of this European standard, what improvements should be done, and to prepare themselves for the ICVAS assurance external audit. And so in our organization, we also have a team of qualified ICVAS consultants and auditors, and we work very closely together with the ministry, shaping the quality on the national level as well. So as the Valakupiaи Rehabilitation Center, we have also a big history of different methodological activities. We act as the organization that creates and tests different methodologies for the people with disabilities, different kinds, starting from physical disabilities, but also with mental, intellectual disorders, and visual sensor as well. And we have created the standards for vocational rehabilitation services in Lithuania. We also do different kinds of trainings We also work with different institutions on the national level, those who are responsible for the social policy. For example, we have a state agency who is responsible for the assessment of the level of disability and working capacity level. So we also work with them, consult how to evaluate the working level of a person with different kinds of disabilities. So it's good that we work a lot on the national level, but also very important to see the what is going on the in the Europe as well. What are doing the European Commission? What are the regulations from there? What's new? What are the innovations in the other partner countries? So we are the members of European Platform of Rehabilitation, and in the partnerships with the members of these organizations, we participate in different projects and also involved in different developments related with the kind of employment support and training and ICT tools and so on. So working together with the partners all over Europe, it's a great support for us. And also we take part in different working groups there. So we have, I will talk a little bit later on about all the financial sources that we get, because we have so many different services. So we also have a lot of financial mechanisms that we get the finances. So one of them is different projects. So it's international or national ones. So we do a lot of projects. At the moment, we are involved in 10 different projects, and they are financed during from all over the different financial mechanisms, like European Structural Fund, of course, European Commission, but also there are some special funds that we get here in Lithuania. So it's like a Norwegian, Iceland, and what is the next? Liechtenstein financial mechanism. So from this mechanism, we implement a very big project that we focus on the youth with disabilities, because the young people who have the disability face a lot of problems to get the education, to get vocational education or higher education, and also to get employed. So for this kind of target group, we work with providing them the support, but also do different researches and work also with not only with the companies searching for the job places, but also with the families of those young people, because sometimes family helps to find a job and sometimes not. So working with the families and parents of these young people also is very needed, and it's kind of one on the focus of 1 hour project. So another projects that we have, so it's starting from different art activities, including people and inviting them to participate in different artistic activities, also the sports activities, as well as different, from these all projects, we also learn how to work, for example, with the employers, how to improve our practices, communicated with the companies, how to support them to think about the new working places in organizations, and so on. So I already mentioned some inspired projects. So as it's a lead project, so this one for the young people. We also work with the artistic activities for people with disabilities. Also had different projects related with that, explaining and training the staff working in the mental health institutions about how to ensure the rights of service users, and so on. If to speak about the last year, so our financial sources that we received, so the biggest part, 46%, was from the medical rehabilitation. Also, the second biggest part was from all these different funds and mechanisms that support project initiatives. We also had social services income and state budget financing. So different programs are financed from different financial sources, institutions, and it means that our administration is also have a lot of job to do to administrate, to work according to the rules of different projects, and to ensure the financial rules and transparency of financial things and so on. But the last year, of course, was difficult and complicated for you and for us. So we had lots of challenges related with the COVID situation, and as the organization, we had to close for several months and to not to work for some of the persons, and for some it was like a distant work from home. So also we learned how to work with part of our service users also in a distance way, using the ICT tools, using meeting them only outside the organizations. Now we are back, and probably half of the last year was that we worked on the normal basis, that we had service users in small groups in our organizations, but when it's possible, all the work was done in a remote way, on the Zoom meetings, via telephone, and so on. And luckily, we didn't have lots of COVID cases in our organizations, and now we have this big national vaccination processes, and most of our staff, those who were willing already, are vaccinated with a full scheme. So we hope that most of the problems are already finished. But we know that it's never going to be the same as it was. So we still are working in the way that we have learned during the last year. So a lot of remote work, lots of meetings online, having all the masks, having a distance, washing the hands, and so on. So that's shortly about our organization. I try to tell you what different things that we do, and our colleagues the next coming days will talk in more details about what we do in our organization.
Thank you very much. It was really a very comprehensive presentation of the organization. I think already you gave us very many, a lot of food for thought, a lot of things to think and compare with our realities. I mean, we have put some questions. Indeed, you answered already some basic for the finances, although we may come back. I would like to start, and then I will give the floor to other colleagues that may have questions as well, is how the users are referred to you. Are they referred by state social services? Do they come directly to you? Are they referred from educational services? Are they referred from at local level? Because you're having national level coverage, as far as I can understand. And you are working also with people who are coming from a distance. And in reality, what I would also like to ask is, when you take a user, a new case, if there are criteria for you to accept it, to accept this person, this user, if it is related to certain decisions at social work centers, at municipal level, let's say, who say that this person should come to Valakupiaи center, or if they are coming on their own, I mean, the actual system of entry of the user into your service, how does it enters? Of course, the personal planning and all that comes later, but the criteria of eligibility for somebody to be your user, because obviously, if I got it right, from your financing, you are paid on the basis of the services that you are providing, especially when it comes to the medical services, etc., etc. And these are not related to the standard state financing. So that's my kind of first block of questions. But maybe other colleagues would like to ask certain things, and then we group the questions and we answer them in groups. So what else you would like to ask? Please take the floor. It's your opportunity now. Okay. Maybe not at the moment. So yes, maybe we can start with the idea of the question of how a user is entering Valakupiai. And it would be very interesting for us to know how is exiting Valakupiai. I mean, what is the average? Let's say if we can make this kind of estimation of a person entering and exiting. Yes.
Thank you, Maria, for the questions. So as you probably understand, we are the public institution, even we are established by the state, but we are getting the money not like a annual budget, but we get as many as we have provided. So for example, different services, different financial sources, different rules. So for vocational rehabilitation of people with disabilities, the financing is coming from and referring is coming from the state employment agency. They are referring those people who are registered in the employment offices and who are of the working age and who has no qualification and or needs a new one. So employment agencies are referring, and we are doing having a contract with them, and we get the money for every person we provided the services.
Okay.
And for social services, we also have a contract with the municipalities, Kaunas or Vilnius municipalities, and we also do the individual contracts with the service users, and as many services we provide, as many financing we get. So for the social services, for vocational rehabilitation, we have like a referring system from the municipality, social units that are responsible for the social protection of the municipality citizens, and from the labor, from the employment agencies to vocational rehabilitation program. For the medical rehabilitation, we have a referring system from different hospitals, because we provide the secondary level of medical rehabilitation. It means that people after the surgeries or after some problems comes only for the medical rehabilitation. So, and money comes from the patient fund, National Patient Fund. And for all other services, like driving school, like social rehabilitation of blind people, also the programs that will be described later on, but I didn't mention about this social workshops and employment support and decision-making program. For this program, we have a very clear criteria who can who could be the service users, but we have proactively search and invite these people. So it means that we do a lot of marketing job, introducing who we are, what kind of services people can get, how it could be useful for them. And we work with all different organizations in the sector, starting, for example, when we, with the youngsters, we try to cooperate and communicate with the schools, also for programs that are focused on the mental health problems. We cooperate with those centers in polyclinics, in the where they get the where all people get the medical help from their family doctors. They also have like special centers where people with mental health problems are coming. So we cooperate with these ones. We also work a lot with different associations of people with disabilities, of NGOs. Usually they are NGOs. So we have to put a lot of efforts to invite people to come for our programs, because almost in all kinds of services, people can choose to what organization then they can come. So it's our job to invite them to offer the high quality of services, and that they could recommend to other people as well. So, and every program has a clear criteria about the age, about the disability level, about the living, probably also where the person is from. So different kind of. And exit.
Can I ask one question, please?
We have some questions already, and I will also give the floor to the question for you, Rasa, is: does your facility have enough capacity to accommodate all people with disability in your city? For Dimitar. Alexandra is asking also, what kind of monitoring and evaluation system is in place? And then from Michaela, thank you for the presentation. As a question, if there is a minimum duration or a maximum duration of using the services per type of service provider. And yes, another colleague wants to ask, please take the floor.
Hello, Dusan. Yes.
Hi, Dule.
Hi, how are you? I can ask I want to know the way of payment. Is the client receive the decision from the municipality of the health institution and they choose the service provider, or you have the list of clients sent from some organization? Because you mentioned that you are fighting on the market with the quality, and you invite the clients to come to your service.
Yes.
Thank you for the question. Maybe I will start with answering to Dusan's question. Yeah. So the way of payments, if the payments is meant how we get the financing for the services, so I already told that there are so many sources, like municipalities, the National Labor Office, Employment Office, also for services like social workshops, decision making, and employment supports. We receive funding from the ESF project. And so there are different way of payments, and the clients, the service users can choose to what organization can go, because there are more organizations who provide vocational rehabilitation, for example, or there are maybe 4 or 5 different social workshops in Vilnius city, and they can choose to.
Yes, but the money follows the client, yes?
Yes,
the money goes to the client and he's paying to you directly.
Yes, always.
Okay, so, okay.
We sometimes make a joke that we really work like a business company, because we have to find our own client, and the more clients we have, the more budget we have, the more money we have.
The price of the services are different or the same with some direction or rules?
it's very different, depending what is included. Is it only the counseling of one specialist, or it's also including the meals or accommodation, or for example, in as I mentioned, in social rehabilitation of blind people, there are a big team, or in vocational rehabilitation is big team involved, and there are like 4 or 6 specialists that were working in one time with a client, with a service user. So it's very different. And you also asked about the list of the service users. So nowadays, when we have such a big focused on the personal data security, so we don't get any service users, potential service users list from any outside organization, except when it's when there is a referring system. For example, employment agency sent us out the client, or the municipality could send us the client, but in other situations, we have some databases. We also do different events that we invite people to come and to see and hear about the services we provide. So it's our marketing really to invite the people. So I hope I answered.
Yes, thank you.
Yeah, and the other questions that are on the chat.
The other questions is about the capacity and how much of the capacity of the city needs you cover, but I think to a certain degree you answered, because you said that at least 5 in Vilnius. Similar.
Yeah, so for different services, we have different organizations, and almost everywhere there is some kind of competition in different between different organizations to invite the person, and usually person can choose to the organization closer to his living place or another priorities that is important for people. So for many programs, we have not only this city, we provide not only for people from Vilnius or Kaunas cities, but also from all over Lithuania. Because, for example, in the driving school program, there is like the only option for people who have movement disabilities to get the driving license for free. It's a special program that supports and helps to be more independent, and coming to our center, they receive the accommodation, the all the support from the instructors, trainers, and so on, and they get from all over Lithuania people come.
So the clients are not contributing?
In some services they contribute. For example, driving school program do not cover the meals, so the person gets accommodation and services. In vocational rehabilitation, that is financed from the National Employment Office, so the person get the services for free, accommodation if he is from another city, and also as an allowance, like to cover the transport or whatever other needs they need. Like
allowance is very important. It's more,
like a stipendium, let's say.
Yeah.
Yeah.
Let me ask something that came also from Michaela. Rasha, what is the average stay of a user in your service, for example, in vocational rehabilitation, because different services, different durations. But if you say, if you take a client for vocational rehabilitation, a user, and you work with him, building employability, soft skills, hard skills, trainings, etc., to prepare him for the employment path to enter the employment market. On average, how much you would say the entry and the exit point?
For the vocational program, it's about could be from 4 months to almost a year, because it really depends what kind of vocational training person selects. So it can be quite short, a few weeks of the training, but also it's a vocational assessment 1 week, vocational orientation 1 week, also support for the employment, several weeks, restoration period. So it depends. If person has a lot of needs for support, he can stay almost for up to 1 year. But if the person has less needs, it might be about 4 or 6 months.
You've mentioned a lot the employment agency and the work you have, the cooperation. We have a lot of colleagues here today from the employment agency and people who are also in decision-making positions. I want to ask you, the first employability assessment, the very first, is it happening at the employment service agency? So to see the level of employability before you start, because there are cases who are very far away from the labor market, what we call complex cases, and they need a lot of support, and there are cases where we have employability readiness. This first assessment is happening in the employment agency or is happening in you? Are you doing it?
So probably our colleagues Darius and is going to talk about this all kind of employment services, and you can ask, and I can tell him that you were asking about this. So as far as I know, the assessment is made in the employment office. They have special forms and questions to ask, evaluate the age of the person, qualification, previous working experience, and so on, different things. Also, disability certificate, what kind of working capacity level a person has. So different things, but probably my colleagues can tell you more because I know just on the general basis. And usually we also have a possibility to, when the employment office is referring to us, we can talk with this person like a first interview, and we ask also questions that are important to us and check if we really can help and what are the situation of a person.
We are just on our break level. If there is any burning question, we can take it now, or we can take it when we come back from the coffee break, which will last for 10 minutes.